All right. Good morning, everyone. Welcome. It is officially Thursday, January 29th. We are nearing the end of the month, and today is Rapid 30. So, my name is Jennifer Bonner. I'm the manager of nursing services here at Archer Review, and I'm incredibly delighted to have you joining me this morning. We're going to go through all the things. We're going to go through questions together, but first, I want to welcome you. So I know that this time can be very different as you're trying to walk through how do I approach these questions? What does this look like? What do I do if I don't understand the information? And we're going to talk about all those things today. So before we jump in, let me know where are you joining me from by dropping that information into the webinar chat. Good morning. Okay, New Mexico, Louisiana. And you're going to see two places to leave some information today. I want you to, if you are answering one of my questions, which we're going to do a lot of that today, I want you to go ahead and put that into the webinar chat. If you have a question for me that you need answered, please go ahead and put that into the Q&A. I'll answer as many of those as I possibly can. Okay, Boston, Canada, Pakistan, Maryland, Las Vegas. Welcome. Welcome, welcome. All right. Great. Philippines, Atlanta, Virginia, New Jersey, Canada. Fabulous. Well, wherever you are joining me from around the world, I always love seeing all the countries that are represented. So welcome. The first thing I want to do is I want to take a look at Archer. And so one thing that I'd like to point out here is if you are getting ready to retake your NCLEX, we do have a repeater discount. If you have not chosen the bundle to start preparing for that, we'll talk about those options as we go. But I did want to make sure that I highlighted that information for you so that you have it available. But we will kind of talk about options, which one you should choose, that kind of thing. If you are wanting to see this recording, it will be available on Facebook and YouTube. We are also streaming to Instagram and TikTok. But if you are wanting to watch this later, please go ahead and check out our Facebook and YouTube page, and those will be available for you later on today. All right, so without further ado, let's take a look at what's going on at Archer. So what I'm going to do is I'm going to start here, and we're going to go on over to NCLEX RN. We're going to scroll down to see what webinars are coming up. And so today you see we have on the 2nd. So today you're joining our Rapid 30. Next week we have study strategies, going to unlock those effective study strategies. That will be with Megan. Next week, it's going to be an amazing offering, and that you won't want to miss. And then we have on the 5th, pharmacology, guess the medication. So there's something for everyone. We're going to go through, kind of give you some clues, see if you can figure out what's going on, use your nursing brain to see what's up. And then you can also see towards the end of the month, well, middle of the month, we have our pharmacology crash course with Lauren that starts on February 16th. So you won't want to miss that. So let's go ahead and check out what tutoring availability we have going on for the end of this week and into next. If you are not familiar with private tutoring, this is a really great opportunity to get some questions answered. If you're struggling with, I don't know where to begin, or I don't know what's going wrong, private tutoring is a great option. We have both 30-minute and 60-minute sessions available. 30-minute sessions are 40, 60-minute sessions are 75. The more you purchase, the bigger the discount you receive, up to 15% off. These are completely individualized. So if you show up and say, I don't know what to do, we can help you. If you show up and go, man, I'm really struggling with pediatrics or OB or mental health or pharm, we can absolutely help you. We can help you make a study plan, get started, sit there as you take questions and kind of listen to your thought process. So we are excited to offer those. You'll see this evening we have a pediatric small group being led by Megan. A small group is an hour session. It's $25 and you get the slides there to work with. Megan's going to lead you through that information. You can interact with her, chat with her throughout that time. But if you've never attended a small group, that's a great value to get that information for a low price. Looks like Emma's sessions for this weekend are sold out. So let's go ahead and take a look at what's going on next week. So we have a session, actually 2 sessions available on February 2nd. We have a private session available on February 4th, along with a fundamental small group. And then there's a private tutoring session on Friday of next week. So if you're interested in those, they go quick. They are in high demand. Please go ahead out there, check that out. All right, well, without further ado, we are going to jump right into our Rapid 30. So I would like to just kind of show you how to get there if you're unfamiliar, but I do have some slides that just kind of put these together a little bit easier. So you're going to go into your Archer dashboard and you are going to scroll on down to your qbank. So qbank, you're going to create test. I would also like to highlight if you are getting to the point where you're running out of questions, you can get the booster. You can also get the exit exam, which are there to come alongside you as well. So whichever one you'd prefer, classic, NGN, or mixed, you're going to choose that. I usually do subject or system, and then I do unused, and then type in the number of questions that you want to take. So without further ado, let's go ahead and jump in. So our first question, the emergency department ED nurse is caring for a client with a hypertensive emergency. The nurse should obtain a prescription for intravenous what? Dobutamine, digoxin, nicardipine, or amiodarone. What do you think? Let me know in the webinar chat. What are your thoughts here? I see a few of you are getting ready to take your exam. We're cheering for you. Please keep us posted. Okay, I'm seeing you guys seem to be going in between. I think I've seen every answer so far except for, nope, I've seen every answer. Okay, so my first tip is that we go through this question and figure out what is it that we're being asked, right? So the emergency department, they're caring for a client, hypertensive emergency. What are we going to get a prescription for? So if I'm going to reword this question, first of all, I've given myself enough time to read through the question completely so I know what I'm being asked. The next thing I'm going to do is figure out what's it actually asking me. And this question is asking me what IV medication am I going to give for hypertensive emergency? So let's look at letter A, dobutamine. So with this being a one answer question, I'm going to see if there's any part of that option that is incorrect. If so, the whole thing is incorrect. So dobutamine is not actually used for hypertensive emergency. It's actually there to increase cardiac output. It increases that myocardial contractility, helps with heart failure, especially in our hypotensive clients. So we're going to go ahead and eliminate letter A. So let me get out my trusty dusty little gadgets here. So eliminate letter A. Now, what about letter B? Let's look at letter toxin. Digoxin actually lost its favorability because there are a lot of drug to drug interactions. And then there's that need for therapeutic monitoring. So we use this in our clients with heart failure, with AFib, but it's not indicated in a hypertensive emergency because it does not have that vasodilation effect that we need. So we're going to go ahead and eliminate letter B. Now, letter C, nicardipine. Now, this is an interesting one. It's a calcium channel blocker, right? And we give this through infusion continuously to do what? To lower that blood pressure, right? Especially during a hypertensive emergency. Now, a lot of times we're going to give this in the critical care, the ICUs, because we know that that frequent blood pressure monitoring is required with this medication. We're going to give this on a pump. While our client is getting that continuous cardiac monitoring. So I like letter C, but we're not going to stop there. We want to make sure that we look at all of our options. So letter D is amiodarone. This is an antiarrhythmic, and it's going to treat those ventricular tachycardias, VFib, AFib, and then that persisting SVT. This has a lot of uses, right? But that hypertensive emergency, that's not one that we use this one for. So our answer here is letter C. Well done. Excellent job. How many of you got that one? I'm incredibly impressed. That is that one's a little bit of a bear. All right, we're going to head on to question number 2. So the nurse is reviewing Hirschsprung's disease with a group of nursing students. It would be appropriate for the nurse to identify the primary treatment as what? Surgical repair, lifelong pancreatic enzymes, gluten-free diet, or fecal microbiota transplant. Some of you are going, fecal transplant. Hey, good morning, UD. Seeing a lot of really great answers here. Looks like you guys are really going in between A and B. Okay, I'm seeing A, I'm seeing B. So let's go ahead and take a look at this. So let's go ahead and figure out what we're being asked. So we've already read through the question. So what is the primary treatment for Hirschsprung's disease? Well, we know Hirschsprung's disease is where those nerves in the GI tract have not occurred. And so what's happening is peristalsis can occur. So what's the one of the first things that we see in a newborn that can give us an idea that we probably are dealing with Hirschsprung's disease? Let me know in the webinar chat. What are some of the things we might see early on? Failure to pass meconium. You got it. Yeah. So we want them to pass that meconium within 24 hours. And these kiddos generally don't do that. And that lets us know something's going on. So basically, peristalsis isn't occurring and that doesn't move the stool out. So letter A, surgical repair like a colostomy. Now that's commonly used for Hirschsprung's disease. There's lots of different surgical approaches that we can use. And that basically that lining of that diseased part of the colon is taken away. And then they pull the normal section through the colon from the inside and attach it to the anus. So like a colectomy. In some cases, they can do an endorectal pull through procedure. And that's where the surgeon comes in. They take that segment of the large intestine that doesn't have those nerve cells and connects it to the first part of the anus. So there is a surgical procedure there. So I like letter A, but let's go ahead and look at our other options. Letter B, pancreatic enzyme. What does that go with? When we see pancreatic enzymes, what disease process does that go with? Let me know in the webinar chat. There's a particular one, cystic fibrosis, right? So I know that goes with CF, so I'm going to go ahead and eliminate letter B. A gluten-free diet. Gluten-free diet is a good treatment for which disease process? Which disease process does gluten-free go with? Celiac disease, right. So we know that gluten is going to be in barley, rye, oats, wheats, things like that. So we can go ahead and eliminate letter C. Now, letter D, fecal microbia transplant. That's a good treatment for individuals that have that recurring C. diff. It involves putting some of a donor, so it's basically donor poop, for a better lack of a better term, and they put that into that recipient's colon. So excellent job, well done on that one. Let's go ahead and clear these out. We're going to head on over to our next question. So our answer there was letter A. Well done. All right, question 3. The nurse is caring for a client with a basilar skull fracture. Which assessment finding requires immediate follow-up? Periorbital ecchymosis, retroauricular or mastoid. Oops, sorry, I'm not sure why that's in there. Ecchymosis, temperature 100.9 degrees Fahrenheit, or headache. What do you think? All right, I'm seeing a lot of great answers here. All right, so let's go ahead and reword this question. So we've read it. So basically, with a client that has basilar skull fracture, which of these do I need to do some type of immediate follow up? So we have periorbital ecchymosis. So let's talk about that one for a moment. So with periorbital ecchymosis, what is that? What does that actually mean? Somebody let me know, just in kind of layman's terms. Bruising under the eyes, right? And that is a expected finding with a basilar skull fracture. So we are expecting that, so we can go ahead and eliminate letter A. So let me get my little thing out there. All right, letter B, retroauricular or mastoid ecchymosis. All right, so what does that mean? What is that? Somebody let me know. If you were going to explain it to me, what does that mean? Someone said battle sign. Bruising behind the ear. Yes. So that's an expected finding that goes with basilar skull fractures, right? Um, if you are planning to join us next week in our 3-day live review, which that is an amazing opportunity for us to go through information together, where we walk through high yield, most commonly seen information on the NCLEX right before you take your exam. We will talk about battle sign, raccoon eyes, that type of thing. But because it's an expected finding, no immediate follow up needed. Now, letter C, a temperature of 100.9. So what are we concerned about with a elevated temp? What are we concerned about with an elevated temp? Someone is saying infection, right? So we know that someone that has basilar skull fracture, that can actually lead to something called meningitis because of that direct communication of the CSF with the ear or nasal passages. And so a lot of times what we see is that otorrhea, rhinorrhea, and that's actually CSF coming out. So the infecting organisms are basically following that tract, created by the skull damage to enter that central nervous system and then circulate in the cerebral spinal fluid. So that fever, we want to figure out what's going on because it definitely could be meningitis. It is not an expected finding when we see this type of trauma. So we're going to hold on to letter C. Letter D, headache after this type of injury actually is expected and would not really require follow up. So we can eliminate letter D. Our answer here is letter C. Well done on that one. All right. So I told you we'd talk about it. If you're struggling with, I don't know where to start, I'm trying to prepare for my exam, I'm really struggling, let me suggest the SurePass combo. The SurePass combo gives you access to all of our on-demand videos, the qbank. It also gives you access to the 3-day live review, which I just talked about a little bit. It is our next one is occurring next Wednesday, Thursday, and Friday. It is 3 days, 7 hours, where we go from beginning to end, from fundamentals to specialties, and we talk through that most important information that you're more likely to see. It does come with, we do offer an ebook with the SurePass combo. And so you can follow along, take notes as you go, but it's a great value. You can find study plans within your Archer dashboard. If you are someone that is just out of school, has taken an NCLEX review course before, I'm going to recommend that 6-week study plan. It goes through everything. It tells you what to do every step of the way, how many questions to take, how to take them, what videos to review, that type of thing. And so it's a great opportunity for you to get that information. If you are RN, I want you to scan the code here on the left, LPNs scan on the right, and see what Archer is all about. All right, well, let's get back to our question here. So question number 4, the nurse is caring for assigned clients. The nurse should initially follow up on the client who what? Has a basilar skull fracture and bruises under their eyes, craniotomy and change in the Glasgow Coma Scale, has amyotrophic lateral sclerosis and requesting to have resuscitation efforts withheld, or has Guillain-Barré syndrome. Let me know. The answer to question number 3 was letter C. Just in case you missed that one, letter C. I think I've seen just about every answer, but it looks like you are going in between letters A, B, and D. I don't think I've seen any C yet. All right, well, let's go ahead and talk through this one. So the nurse is caring for those assigned clients. Okay, so basically, out of these clients, out of the clients that are on my list, who do I need to initially follow up with? So I know that because I'm seeing this word initially, what type of question is this? I've already identified the type of question. What is it? It is a priority question. You absolutely got it. Well done. So, a basilar skull fracture. Now, we know with a basilar skull fracture, having bruises under their eyes, um, we know that that is a normal finding with that. It can come with vision changes, bruising, post-auricular ecchymosis, altered mental status. The client does not require follow-up because it's an expected finding with what we have going on. So we can go ahead and eliminate letter A. Now, letter B, we have a decrease in that Glasgow Coma Scale, pretty significant from 13 to 11. And that's concerning because we see this neurological functioning that is worsening, right? So if the GCS were increasing, that would be reassuring. But we need to follow up with this client because that rapid change in the assessment is really important. We need to figure out what's going on there. So I like letter B. But what about letter C?
Well, we know that ALS does not have a cure, has poor prognosis, and the treatment for that is what? What's our treatment there? It's very symptomatic, right? We're going to be talking about those advanced directives, but it's not a acute or concerning finding here compared to our client with GCS. We do need to have this conversation with our client, but compared to letter B, it's not a priority here. Now, the last one has Guillain-Barré syndrome reporting lower extremity muscle weakness. So that's an expected finding with Guillain-Barré syndrome, that ascending paralysis, painful neuropathy, dysautonomia are all other things that we would see going along with this condition. So my answer here is letter B. Excellent job. So I just want to say thank you so much. I know that you guys are working hard. I know many of you are in the thick of nursing school. Many of you are trying to work on passing that NCLEX. I saw several of you who are getting ready to take your boards next week. Well done. We are here. We're cheering you on. Please keep us posted on how things go for you. And remember, wherever you are on this nursing journey, we have a place for you. There is a community here for you, ready to support you, ready to come alongside you in this journey. Whether you just decided you're ready to go to nursing school, or you're in the thick of it, you're getting ready to take your boards, or you decided, hey, I'm going to go become an APRN, there's a space here for you at Archer Review. So thank you so much for joining me today. It's been a pleasure working with you. Well done, and we'll see you back next week. Take care, everyone.